Well, hello everyone, and welcome to today's webinar. My name's Yeshua, and I'm the Outreach and Social Media Coordinator for the Canadian Cancer Survivors Network. On behalf of CCSN, I'd like to thank you for attending today's webinar titled The Emotional Impact of Cancer. If you are new to one of our webinars, let me just take a moment to give you a brief overview of our organization. The Canadian Cancer Survivor Network is an organization working with cancer patients and survivors to learn about the complexities of our health system, to connect with others, to plan action and act on those plans to promote better care and healthier survivorship. If you would like to learn more about CCSN, please visit our website at www.survivornet.ca. You'll find plenty of information there on us, as well as news, events, and other resources that we think you'll find helpful. One final announcement before I hand things over to our presenter is that this webinar is being recorded and it will be available tomorrow on YouTube. In addition, the slides will be available on SlideShare, and links will be sent to both, or links for both will be sent to you via the email that you provided, so you can share this resource or go back and watch it again if you'd like. At the end of our presentation, we will have a Q&A session. However, don't feel like you have to wait until the end. You can use the chat feature in the at the bottom right of your screen, and you can type in your questions there. We'll be able to look at them and ask them to Dr. Laurie. CCSN is pleased to welcome our presenter for today's webinar, Dr. Laurie McFarlane from InspireHealth. Dr. McFarlane received her doctorate of medicine from the University of Western Ontario in 1991. After completing her family medicine residency at the University of British Columbia in '93, she practiced full-service family medicine in Vancouver with an emphasis on obstetrics. In 2013, Dr. McFarlane was delighted to join the InspireHealth team. She's honored to provide support and empower patients as they navigate through a cancer journey. For her own self-care, she strums on her ukulele, tends her garden, practices yoga, hikes, and cherishes time spent with her husband of 39 years. In today's session, she will discuss the emotional aspects of cancer, the cancer journey, and explore ways to express and manage emotions to help improve our health and well-being. So please welcome Dr. Laurie McFarlane.
Thank you so much, Yeshua. Thank you for that kind introduction, and thank you for the invitation to present today. I'm really pleased to be able to talk to you today about the emotional impact of cancer. We know from research and certainly from our day-to-day interactions with patients that the emotional aspects of living with cancer can be some of the most challenging to understand, to process, and to get support for. So I'm hoping that by the end of our presentation today, I'm sorry, you can just hear my phone ringing now. By the end of our presentation today, you will feel more comfortable appreciating and understanding your emotions. This is the beauty of working at home. Sorry, I'm just trying to advance the slide here. And it's not advancing. Oh, There we go. Okay, so we always start off with declarations, none today other than the fact that my wages are compensated by InspireHealth to be here with you. So a little bit about InspireHealth. Sorry, this is a bit finicky, this pointer. I know that a couple of my colleagues have given talks for you in the past. One of our exercise therapists has spoken, one of our dietitians. So for those of you not familiar with InspireHealth, we're a not-for-profit charity founded in 1997. We have locations in Vancouver, in Victoria, that's the office with which I'm affiliated, and in Kelowna. And we have a significant online presence, certainly since the pandemic. We certainly had an online presence prior to the pandemic. But since March of 2020, we have offered all of our programs and services online, and our individual support is done either virtually like this or on telephone. So we use evidence and research to create programs to help patients, to help you play an active role in your cancer care. So our motto really is all about allowing people to take charge of their health. And we provide support in areas of nutrition, counseling, stress reduction, exercise. I help folks a lot with understanding their medical reports, their imaging, thinking through treatment decisions, and so on. So we have a multidisciplinary team, and that is how we can provide that full service, individualized cancer support. So today I'm going to talk about some common emotions with cancer, what emotions are and why do we have them, and then finish up with some tools for navigating and supporting our emotions, as Yeshua was saying. So before I delve into the impact of emotions, just a slide on the impact of cancer. We know that cancer is diagnosed in nearly 50% of Canadians over the course of their lifetime. Cancer is the leading cause of death. These are 2016 statistics, but they hold today, with cancer accounting for about 1/3 of the deaths annually in cancer. We are making some progress over the last 80 years. The 5-year survival rate has improved for someone diagnosed with cancer. It's increased from about 25% to over 60%. And for many cancers, that number is approaching 100%. So for many people, cancer really is more of a chronic illness like heart disease or diabetes that is a disease that is lived with over the course of many years. While treatment and early detection have certainly improved, there's no question that there remains large gaps in the areas of supporting people's mental health and emotional health during cancer and after cancer. So we also know, sorry, that was 2 clicks. Hang on. Stop. No, see? Okay. We also know that cancer, of course, impacts the whole person. You're not just your diagnosis of cancer. When I was in medical school back in the 80s, I was told to go see the pneumonia in room 312. And I used to say, you know, does the pneumonia have a name? And does the pneumonia have a family? So cancer impacts the whole person. And we all are going to respond individually and emotionally in our own ways related to our genetic makeup, related to our upbringing, related to our age and stage, our financial situation, our work situation. All of these elements are going to impact how we deal emotionally with our cancer. Cancer, of course, impacts family and friends. I've heard from so many people that cancer helps to really shine a magnifying glass on relationships and friendships, with some of them dissolving and some of them strengthening related to cancer. The COVID-19 pandemic has certainly magnified the impact of the emotional distress in cancer. In fact, the Canadian Cancer Survivor Network has commissioned 3 surveys exploring the emotional aspects of COVID-19 and cancer. The 3rd study was undertaken middle of June to early July, and the results of that were presented in this forum in a webinar a few weeks ago. And what they showed was that overall about 50% of patients surveyed had appointments canceled, rescheduled, or postponed. Many of them didn't even have a new date for their appointment. Likewise with treatments and surgeries. And these delays, when they did have new appointments, were often out 4 to 6 weeks. And we know that this waiting period is significantly stressful for people. Overall, 69% of respondents said that when appointments were canceled or treatments canceled or delayed, that had major negative emotional impacts, with increased stress, worry, and all complicated by the isolation. I have a very finicky pointer here. No, it's not. There we go. Okay. So here's some common emotions with cancer, and this is by no means an exhaustive list. But you can read down that list, and I'm sure that many of you will be able to say that you have experienced or are experiencing any or all of those emotions while living with cancer. Emotions are often described as waves. They can come and go, or as this illustration shows, emotions are typically not associated with the meandering green cat run down a mountain, but more like the terrifying to me anyway, double black diamond run, that just sort of that uncertainty. So emotions can flare certainly with diagnosis, with treatment changes, particularly if treatment changes have come kind of out of the blue for people, or you're in the midst of treatment and things get shifted or changed related to how you're managing physiologically with the treatment. If there's a cancer recurrence, emotional waves can happen, or if treatment is transitioning from a curative approach to a palliative approach, that would be another time. And another time that emotions can flare, and it surprises people, is when treatment has been completed. So for cancers where there's a very defined surgery, chemo plus or minus radiation, that's all finished, and people sort of think, oh, I'm done. I can just kind of get back to my so-called new normal. And that's when these kinds of emotions can really catch people off guard. And again, it's important to learn to understand your emotions, what they mean, and to seek help as needed. So here's another survey done by the Canadian Partnership Against Cancer. It was a Canadian-wide survey, a very comprehensive study looking at the experiences of individuals and their families living with cancer and beyond. And they found that emotional distress was the most negatively rated dimension of care in cancer patients, with 70% reporting the emotional challenges after treatment ends, just what we were talking about. Worry about cancer returning is the most difficult to get help for, and I would say in my experience, meeting with patients, it's one of the most common worries, fear of recurrence. I would say that I talk to people about this most days. Only 50% who have these emotional challenges believe that they have received useful information that address their needs. So we really do have a gap in our mental emotional care support. Sorry. Oh, I'm getting ahead. I'm trying to go back now. Okay. My goodness. I have a brand new computer and this pointer is finicky. Oh dear. So this is the slide I want. What are emotions? Well, they're information about what is going on inside of us. They're really nothing more or nothing less than that. They're offering us information. And at any given time, most of us are experiencing more than one emotion. And Dr. Mark Brackett, who is the founder and director of the Yale Center for Emotional Intelligence, has said, our emotions are a continuous flow, not an occasional event. Inside each of us, there is a river, placid and contained sometimes, raging and overflowing its banks at other times. That's a lot to navigate. So I think envisioning our emotions as a river can be really helpful. It can help to understand the waves, the overflowing, the calmness at times. And we know that there are three key elements of emotion, and we will tease this out a little bit as we go along. But first, there will be a subjective experience, an illness, a birth, a death, a graduation, any kind of subjective experience. Related to that will be a physiological response that's natural, normal, wired into us. And then related to that, there will be a behavioral response. So again, I'm going to try to advance one slide now. Let's see. Ta-da. Okay. So Dr. Mark Brackett, the same psychologist I just referenced, he's created this schematic that I find really helpful called the mood meter. And you can see here that he has placed emotions along two axes, a horizontal unpleasant to pleasant axis and a vertical low energy to high energy axis. And what I like about this model is it illustrates the fact that we have many and nuanced emotions. We tend to think of kind of the triad of glad, mad, sad, and then we tend to put emotions on a scale of good and bad. And bad emotions we shouldn't have, and good emotions we should have. And really, emotions are neither good nor bad. They just are. So I think that this idea of considering emotions along that scale of unpleasant, difficult, challenging to pleasant, welcome, low energy to high energy can be a really helpful way to look at emotions. So that's my teaching point number one, is that emotions are neither good nor bad. They are information. So here's a question we ask ourselves, we ask each other, how are you feeling? And imagine if we actually took the time to answer this truthfully. As the illustration shows here, for many of us, it would be like opening a can of worms, and we really don't have a lot of practice in this area. We're typically not taught as children how to name and express our emotions in a healthful way. What we do know, though, is that repressed or suppressed emotions don't go away. There are ways of understanding them, embracing them even, and that this concept of emotional intelligence is a skill. And I'm going to get to that in a minute, but I just wanted to say a word about the emotion that I hear so often in the cancer world, and I don't hear it in other diseases, and that is think positively. That's the emotion. It's like this mantra of, I've got cancer, I'm going to think positively. I'm thinking positively. Other people are telling me to think positively. I'm telling myself to think positively. And let's be honest, there's a lot of times when you are not thinking positively. You're angry, you're frightened, you're sad. And these are really natural emotions. So people say, but Lori, I've worked so hard to kind of keep those so-called, now you know they're not bad, keep those so-called bad emotions under wraps in the name of feeling positively. It's not really working well for me, but I've been trying. And I say, well, that's okay. You know, it's important to feel all emotions, to be able to bring them up, to be able to name them, and then to be able to do something about it. And then people feel guilty because they've now been inappropriately trying to suppress their emotions. So there's a lot of guilt in patients with cancer. I see it quite commonly. So I'm hoping by the end of our presentation that you will be able to say to yourself, wow, I don't need to be this hard on myself. I can just feel what I have to feel and learn to manage it. So I'm really hoping that if you are feeling guilt around the whole notion of positive thinking that's not feeling right for you, that you can just let that go. So what is emotional intelligence? There's a ruler mnemonic here, also the work of Dr. Mark Brackett. I'm sorry, I put it in green for the first letters. It hasn't really punched out like I was hoping. But recognize emotion. So being able to recognize emotion in the face, in the body, in the voice, to understand the causes and the consequences of emotion and how emotions drive our decisions, our thinking, and our behavior. To be able to appropriately label emotions. When I showed you that mood meter, that was many, many different labels that we can put onto emotions. For example, disappointment versus anger, where disappointment would be unmet expectations. Anger would have more of a perceived injustice component. Learning to express our emotions mindfully, that's a task. And then finally, learning to regulate emotions. What sorts of things can we do to regulate our emotions? If we're going to allow all of these emotions to just surface up, like I've told you, is perfectly normal and okay, then we need to learn to be able to do something about that. So just getting back to the mood meter with the simpler version here, with a diagnosis of cancer, people often spend time in the blue and the red quadrants. And again, That is normal. And I think it's really helpful to understand what is going on physiologically. We talked about the subjective experience, the physiological experience, and then the behavioral experience of emotion. So when we are in the red and the blue quadrants of emotion, what's going on is that we're in an acute stress response. So we are all conditioned, this is our neurology, we're conditioned to initially react with an acute stress with a fight, flight, or freeze response. Those are the behaviors that we see. As I say, it's normal, it's our survival brain. The problems can come when we become unknowingly stuck in this response pattern, and it can become chronic. And we have more difficulty identifying that we're in it and what to do about how to get out of it. So I'm a physician, so I have to put up a couple of neuroanatomical slides. So here's our autonomic nervous system. This is our automatic pilot system. This is a nervous system that helps us to act without thinking. And it's divided into two branches. Our sympathetic nervous system is illustrated here on the left, and our parasympathetic nervous system is shown on the right. Sympathetic nervous system associated with fight, flight, or freeze. Parasympathetic with rest and digest. And you can see that all the organs of our body are innervated by both branches of the autonomic nervous system. So if I go into a darkened room and I'm feeling afraid, I don't say pupils dilate, I need to see better, or heart beat quickly because I may have to get going, or blood shunt to my muscles so that I can move. Those things all happen automatically. So this is an automatically wired system that kicks in when we are in an acute stress situation. I was listening on the radio last week, and you may have heard this on the radio. There was a story, it was actually a story about how there aren't enough family doctors in Nova Scotia. And the announcer was interviewing a couple, and he had had a heart attack. So the story went that he was going off on his boat. He left the house. He was going to sail up to Halifax. His wife wasn't too happy about all this. He phoned her from the boat and said he needed some help. And she thought, oh boy, what's going on? And then he just sort of faded and said help. And she immediately knew that something was wrong. So she jumped into her car, drove down to the marina, which was quite close by, jumped onto her paddleboarded out to the sailboat, found her husband, fairly unresponsive and ashen, heaved him over the side of the sailboat into the rowboat while phoning 911 and rowing back to shore and meeting 911. And he did fine. And the story was really related to the fact that he had no aftercare. But as I was listening, I thought to myself, my gosh, that is a shining example of our sympathetic nervous system doing what it's designed to do. So when our acute stress is something that requires that heroic strength, acting without thinking, it is very, very useful. When the stressors are more of an emotional nature, and if we stay stuck in it, perhaps not so useful. So the fight, flight, or freeze, the three behavioral responses that can accompany this sympathetic nervous system discharge. So fight, you may think, well, I'm not really an aggressive or violent person. But in the emotional realm, it can come out in judgment, people not doing the things that they should be doing, should and shouldn'ting people. Angry, being irritable, passive aggressiveness, judging oneself as well as others can come out as a behavioral form of fight. Flight can often take the form of obsessive thinking that what if this happens, and then what if that happens? And I tell people it's like this what if vortex. We haven't even sorted out the first what if, and we're already on the 15th. So we can just get into this whirlwind of emotional obsessive thinking. Or flight might take the form of fatigue, withdrawing, avoiding people and situations, workaholism, certainly online. If that's not easy to go down rabbit holes, I don't know what is. Substances to numb can be part of a flight response to an acute stressor. And now I've hit it twice. Okay, this is hilarious because I'm about to bring up freeze. Okay, there we go. I was going to say my whole presentation is freezing. So freezing. feeling numb, feeling disconnected. People say, I just don't feel like I'm in my body anymore. The brain's not working. You can't make decisions. You're feeling confused. And really what's happening is that prefrontal cortex, the front of your brain, is just kind of shutting off. And the emotional, the limbic system, that is driving your fight, flight, or freeze response. So it's not surprising then when we are in this acute stressor that, that we have much more difficulty making decisions. Now, the good news is that we've got this counterbalancing parasympathetic nervous system. Again, the nerves go to all of our organs and they send different chemical messages that basically tell us life is good, everything's fine, I'm calm. And it's in this state that we digest our food. So it's called the rest and digest. So why understanding emotions matters? It's because we can regulate, it's that last R in the emotional intelligence. It's regulating our emotions, and we can learn to regulate them in rest and digest. So being able to practice strategies to shift ourselves from sympathetic to parasympathetic can be really helpful. And in so doing, attention, memory, and learning are increased. That makes sense. We've got our cognitive brain kind of clicking back in again. We're going to make better decisions around our health. We're going to be more likely to adhere to treatment, to participate in screening programs that are recommended, to adopt healthy lifestyles. It's going to promote healthier relationships, and that makes sense. If our own emotional world is better understood, we're going to better understand others, their body language, the avoidance, the connect cues. Our physical and mental health will be improved, and it's been shown that performance and creativity are improved when people are better able to manage and process their emotions. Okay, so there are there are more than 5 ways, but here are 5 ways to mindfully be with your emotions. And the first is stop. And I think that is really where we need to start, is with stop. So stop, it's an acronym for stop. S is for stop or pause. Take a deep breath. Observe. And proceed mindfully. And we'll talk about the observe and proceed mindfully pieces. So this gorgeous photograph was taken by my InspireHealth colleague, her cherry blossom tree in full blossom here this past spring. And she used it as her prompt so that every morning while getting into her car on the way to work, she would look at the cherry tree and do a stop. Stop, breath, observe, proceed. And she would repeat the process when she came home from work. So that was her prompt. And again, it just gets you into the habit. It's hard to know when we're slipping into that acute stress response. That's the kind of the whole purpose of it, is that we really don't have that awareness. So purposefully putting into place practices to help us touch base with that can be really helpful. Nudge your inner judge. So this is the concept that we have feelings about feelings. So we often become judgmental with feelings. So the idea is to drop the judgment and to think about, why am I feeling this way? So I have a little story here. It's called the arrows story. It's a metaphorical story illustrating this idea of feelings about feelings. And so I'm just going to read it to you. It says, something sad happens and we are shot with an arrow of sadness. And instead of noticing this arrow and being compassionate with it, we judge it. I shouldn't feel sad. Sadness is weakness. I hate being sad. This is overwhelming. I can't handle this. And now, instead of just feeling sad, we are feeling hopeless, overwhelmed, angry, shameful, guilty. And now we've shot ourselves with multiple arrows. So really important when you're doing the kind of observe portion of the observe and the stop mnemonic, to try to get back to that initial core emotion, and then to say to yourself, where did this come from? What's going on? Our third jingly rhyme, name it to tame it. So this is the idea that we're going to express and not repress our emotions, and to think about, I feel blah, because blah. So what is this emotion telling me? Helping yourself to more accurately label and then appropriately express that emotion. Feel it to heal it. So these are heat maps of different emotions in the body. It makes sense physiologically, things are going on. So taking time, sometimes with a body scan, people start feet to toe to foot to head or head to toe, just sort of checking in with your body. I like to kind of, put a hand on my belly, a hand on my chest, and just, is my heart rate going more quickly than I think it should for the fact that I'm just sitting here? How's my belly feeling? How's my digestion? What are my shoulders feeling like, tense or relaxed? And for people, if you're having pain or discomfort related to your cancer or your treatment, these may be really difficult practices. So it may be more important to try something a little bit different, or to try to tune in to a part of your body that has not been giving you difficulty. And finally, to be able to be with your emotions mindfully, it's important to be with yourself compassionately. Dr. Kristen Neff has done some wonderful work in this area of self-compassion. If you're not familiar with her work, her website, selfcompassion.org, is very useful. She's got some lovely loving kindness medications, and she says, treat yourself as you would treat a good friend. When these emotions are coming up, to be able to say to yourself, what do I need? What is this emotion telling me? So if feelings could talk, these are just some examples. Sadness might be telling me I need to have a cry. Loneliness, I might need connection. Shame, I might need self-compassion. Resentment, to think about forgiving, one of the harder things I find. Emptiness, to do something creative. Anger, to check in with my boundaries. Anxiety, to breathe. And stress, to take it one step at a time. So again, just trying to learn, what are your emotions telling you? So managing our health is really related to managing our mental and our physical health, of course. I mean, we talk about mind-body connection, and it truly is connected. We sometimes think, I don't know, this is kind of psychiatry and our emotions, and the rest of us is our physical body. And we know with mind-body connection, mind-body research, that it's all intricately tied together. So mindfulness is a concept that I'm sure you are familiar with. We hear about it all the time, and it's being defined different ways, but basically it's paying attention on purpose in the present moment, non-judgmentally. So that kind of sounds fairly simple, and it's not at all easy. So there are different ways that we can be mindful, to be more mindful with our emotions, so that we can do the little jingly rhymes that I, name it to tame it, nudge the judge, feel it to heal it. I have to say, when I first read those little rhymes, I thought, oh my, that's a bit trite. But it's amazing how often I'll say to myself, Lori, name it to tame it. What's going on? I'll just, I sort of, invoke these little jingles. So mindfulness is a technique, and there are many, many, many different practices that can be used to create mindfulness. A breathing practice is one such way. And again, if shortness of breath is something that you are experiencing as part of your cancer or your treatment, a deep breathing practice may not be appropriate for you. It may be other ways that are more appropriate. For people for whom a breathing practice is accessible, it can be a really, really good way to step from fight, flight, or freeze into rest and digest. And I like to do it, again, with a hand on my chest. You can't see me, but I've got a hand on my belly. And with a deep in-breath, the belly is going to expand out, the chest out. And with the out-breath, chest in, belly in. So just some few deep breaths. It's quite amazing how that can really calm, and it makes sense. It's called diaphragmatic breathing. That helps to stimulate something called the vagus nerve. and the vagus nerve is critically important to the parasympathetic nervous system. So basically, we're telling our brain that everything's okay, and then our brain says, oh, everything's okay. Then I will send my other parasympathetic nerves those messages so that the rest of you can calm down. Your heart rate can calm, your blood flow can go to your belly so that you can digest the meal that you've just eaten, and just feel more calm and relaxed. So I took this slide from one of our counselors' presentations, and I really like this. This shows that the mindfulness about which we are speaking would be the cloud on the right. We do tend to have very busy, thoughtful brains, and the idea is not that we're going to empty ourselves of this. The idea is just to try to find a practice that's going to bring us more awareness of how we're feeling. And when I look at this slide, I think of using the 5 senses. So this is the idea that what do I hear, see, smell, taste, and feel? And in this illustration, the cartoon character is seeing the sun and the trees and, perhaps the dog out of the periphery. It's not shown in the cloud. And this is a technique I have found very, very helpful. I live on the West Coast. I live on an island. I tend to go out for a morning brisk walk or a bike ride. I can bike along the east shore of our island and see the ocean. And I have a particularly gorgeous ocean view as I'm coming around one corner. And I always say out loud, "Good morning, ocean." And I say it as a way to trigger the 5 senses. So I say, "Good morning, ocean," and then I say, "Good morning, tide." I actually say this out loud. And it helps me. I think, okay, this is what I'm doing. And then I feel the wind on my face, and I take the smell of the fresh air, and I listen to the birds. And this morning I was listening to the owls hooting. They're just going crazy right now. So as a way to, again, just bring ourselves more mindfully into the present moment. So here's a tree of contemplative practices, and I think it really nicely illustrates the fact that there are so many different ways that we can use to help bring ourselves into this parasympathetic tone so that we can, again, just better process our emotions. Right from things like meditation and centering to things perhaps with a bit more activity, labyrinth walking, walking meditation, yoga, dance, over on the left side, journaling, improvisation, visualization, and even activities with kind of a social component, work and volunteering, and so on. And we all can find something, I think, on this tree that would suit us. I remember years ago when my mom was coming from Ontario to visit me in Vancouver, and she'd found out about a labyrinth that had been created in the backyard of a church downtown, and she was very excited to walk this labyrinth. So off we went, and she walked the labyrinth and was just zen at the end of it. And I have to say, I was not getting the zen out of the labyrinth. And maybe I wasn't trying hard enough. Maybe the labyrinth really isn't my thing. Hard to know. But if I get my ukulele out and start strumming and singing, I'm in the present moment. I find it hard to be, angry, mad, sad when I'm playing my ukulele. So we all have different ways that we can just foster those mind-body connections. We also know that self-care around nourishing our body, exercising our body, and resting our body can really help our emotional health. And it's hard to know what the chicken and egg is in all of this. We're feeling better emotionally, so we're eating more healthfully. But the contrary is true. If we eat more healthfully, it's actually going to help our emotions. And the more that we're learning about the gut microbiome, this is a fascinating area of research to me. So these are the bacteria that live in our gut. And if we feed them nice, mostly plant-based whole foods, they are just factories of production of serotonin, which is one of our feel-good molecules. So the saying gut feeling really is quite true, that if we can eat well, it puts our bodies into a lower inflammatory state. It allows for the production of these healthy bacteria, and that can help our emotions. Hydration as well. I think for many of us, we are, sort of chronically dehydrated. So being careful to hydrate with more water, certainly less alcohol and caffeine. And rest and move, and balancing those two. Sleep and rest are hugely important, particularly in the setting of cancer. One of my former colleagues always called sleep the crust of the healing pie, and I always like that. We often spend an entire consultation talking to people about sleep and how to optimize sleep, different techniques for that. And movement, very, very important. And again, depending on how you're doing with treatment or afterwards, movement is a really good way to foster those mind-body connections. And time in nature. So we try not to should too much at Inspire Health, but let's rephrase here. Consider sitting in nature for 20 minutes a day. Unless you're busy, then you should sit for an hour. So this is our model of supportive cancer care at Inspire Health. As you can see here, there are many, many ways that we can shift, optimize our lifestyle, our emotional health to support the whole person that we are and the person who has a diagnosis of cancer. We have various ways to help people support their emotional health at Inspire Health. There are one-on-one consultations with the physicians, same with our clinical counselors. We have inspired conversation workshops. We have 4 meditation classes weekly. We have yoga and qigong for rest and relaxation. So many different ways that mental and emotional health can be supported with us. And, oh, just a second. Hang on, I need to go back to, there we go. I'm sorry, I'm out of the slide, or it looks like I'm back into the sort of whole thing here. So, oh, now we're back at the beginning. I think Yeshua is helping me, bless him. Thank you, Yeshua. Okay. Oops, there it goes again. That's okay. It's a summary slide of Inspire Health to say that our services are free. No referral is required because we are doing all of our consultations right now online, and we will continue to provide online consultations. We really have broadened our reach. Previously, I saw mostly patients from Vancouver Island. I am now seeing patients throughout BC and even throughout Canada. So we have a nice website, inspirehealth.ca. If you would like more information about our services, we would be certainly pleased to support you. And I'm happy to entertain questions. Okay, so Yeshua, have you got a final slide there? Should I put it up?
Put it up here, I think.
That's your CCSN contact info.
Yeah, that's
Yeah,
us
great.
here at CCSN. We do have a number of questions that came in.
Okay.
And so for those asking, I apologize if I don't read the entire thing because some are fairly specific.
Okay.
However, I will try to get the gist of them in for us. What is your advice in a situation where one has to deal with external stressors in addition to emotions, such as being having to fight your cancer or deal with your cancer, as well as say insurance companies or other sorts of external stressors?
Oh my goodness, that is it. Thank you for the question. That is a really, really common situation for people. And I think that I've had so many, I had just had a patient yesterday say, Lori, really, the cancer I think I can manage. It's the healthcare system that I'm really, really struggling with, and insurance companies and so on. So again, I think it's a matter of controlling and supporting the emotions that we can to the best of our ability. So doing our best to optimize our sleep, our nutrition, our movement, to try to get those things under control so that we'll have a little bit more resource available to manage the other. The other thing is to ask for help. I have written letters for people, for insurance companies. Talk to your family doctor, talk to a counselor if you can, reach out for that kind of support. Because I think you're right. There are so many stressors, especially living with cancer, over which we have very little control. So to control the things we can first, as I say, to have a bit more energy to deal with some of these other things. But don't hesitate to reach out for support. It really can be a quagmire of nuttiness having to navigate some of that. That's a medical term, quagmire of nuttiness. Yeah, thank you.
Thanks. The next question asks, can you be in the 3 states at the same time, so fight, flight, and freeze?
Absolutely. Yeah, I think that there are components of that, right? You can be angry while you're immersed into your internet and also feeling disconnected from your body. So there's no question that any or all components, and again, we all have our own wiring, our own life experience, our own upbringing, our own surroundings that are going to help sort of shift or change or foster one of those states maybe more than the other. And it can shift, and we could have another thing that makes us really angry 3 weeks from now and respond a little bit differently depending on how we're feeling that day. So yes, it is possible. And the important thing again is not that we're there. We're going to go there. It's the way we're wired. And it's just to be able to at some point say, wow, I think I'm in parasympathetic mode inappropriately. What can I do to get out of it? And that is not going to happen quickly. Again, please don't be beating yourself up. If you sort of like, whatever, a month, a year later, you're saying, my goodness, I've been in a perpetual state of emotional distress. That's the way it's been. It's time to just regroup. Talk to somebody if you have to, talk to a loved one, talk to a friend, talk to a physician, a counselor, because the idea is simply to be able to, again, as I said, to be mindfully with your emotions so that you can then do something about it.
One that is there, I'm just trying to make it less specific to our asker.
Mm-hmm.
For somebody who may not have grown up in a place where emotional intelligence was given a high degree of importance, how can we develop our emotional intelligence where we are now?
Right. I think that's a great question, and because really none of us has been raised with these, probably, raised to, oh, Lori, it looks to me like you had a bad day at school today when I'm in grade 2. Can you tell me how are you feeling about that? And then I would try to express emotions, and my, parents would say, well, what about these other emotions? Are you feeling like that? So I think it's a matter of practicing. Dr. Mark Brackett, who I referenced, he's got some great YouTube videos, and really his work actually is mostly related to teaching children in classrooms and teaching teachers and teaching administrators. So it really is just starting to practice. It's putting into place the stops. Maybe once a day, you kind of add that to your morning routine. Stop, take a deep breath, observe, how am I feeling in my body, and then proceed. So what am I going to do? Am I going to, and there's so many different ways. You're going to do some exercise, you're going to pick up the phone and phone somebody, you're going to have a nap, you're going to have a large glass of water because maybe you're a bit dehydrated. One of my favorites is just to put music on and dance like crazy in my kitchen. So different ways that we can try to name and then act upon our emotions. So as I say, it's a skill. It's a skill that we're not born with. It's not a skill our society, I don't even think, particularly values. We're in a very kind of efficient, productive society, and we think of emotions as getting in the way of that rather than enhancing it. And yet, if you were to talk to any teacher, anyone in relationship, the biggest challenges can be around emotional disconnection, if you will, between yourself and your partner. So be gentle, be kind, be patient, and it's lifelong. It's never too early or too late to start, as I said, and it'll come in time, and there will be days when you're feeling just top of the world emotionally intelligent, and others when you are not feeling at all like that, and that's okay too.
Thanks. We have a number of questions. I don't know if we'll get to them all. They keep coming in, which is great. But I'll ask this next one. What is the best way to deal with the fear of recurrence of the cancer?
Yeah, that's a really important question, because as I said, it's something that we deal with a lot. And I would say at InspireHealth, between meeting together with the physicians and meeting together with the clinical counselors, actually, all of the team, because part of it, again, as I said, it's learning to take control of the things that you can take control of. So really thinking about your diet, really thinking about your exercise, really thinking about your sleep. Some people like a lot of information. I spend a lot of time with some people going over consultants' reports, making sure that they are tickety-boo with all of their with all of the follow-up suggestions. Some people find information far too overwhelming, and gosh knows there's a lot of it out there. And they're better to just sort of say, I've had enough of information. I just need to lead the life I'm going to lead. So again, it's around learning to control and manage the things you can. And then, but if you find yourself in the whirly-dirlies, you just aren't, you're not sleeping, you're ruminating, you're into that, the flight portion of the obsessive thinking, you're worried that every time you have a cough, does that mean the cancer's come back? It can be helpful to talk through strategies around how to manage that. So, for example, as I'm thinking of the cough, sometimes I'll say to someone, okay, if you have a cough, then maybe, live with it for a little while, unless it's obviously getting worse and worse and worse and worse. But for most people, after a cancer diagnosis, let's be honest, you're going to be more hypervigilant about your health and about worry. And if you're worried, you go and see someone. And of course, this is now more difficult. It's a pandemic. It's hard to see somebody. But to at least be able to talk to somebody, to be able to say, this is a symptom I'm having, what do you think? Is this something I should worry about? If you're spiraling, then reach out for some support.
Here's a really interesting question. Some drugs stimulate emotions and intensity. Any thoughts on how we can manage that?
Yeah, that is so true. I'm thinking off the top of my head of the steroids, dexamethasone, prednisone, which are used incredibly commonly in cancer, and my golly, they can fiddle with one's emotions. So I think and they can interfere with your sleep as well, which then is going to, complicate your emotions. So I would say for those medications, if they need to be taken chronically, then again, it's going to be a matter of best you can, optimizing other aspects of your lifestyle. I mean, those would be the times when I would even, I would avoid alcohol, I would even avoid caffeine. Having said that, if those are the things that you love, 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 and they bring you a lot of joy and meaning, then maybe you have a little bit, but you are really mindful about it. You have a very good glass of wine and you sip it slowly and you really, really enjoy it. So to be very careful of, again, of the things that you can control. And for sleep, some people need to then have extra medication. I mean, it starts to get into this medication to treat medication, and that can get to be a bit of a snowball as well. But I find that the diet, the exercise, the joy, what brings you joy, making sure that you're doing some of those things that bring you joy. And again, it's more complicated now with the pandemic. We can't always be seeing the ones that we love and want to spend time with and hug our grandkids, because all of those things are going to, again, help kind of keep us into that parasympathetic tone.
Awesome, thank you. And one last question. Are the Inspire Health services available to folks with non-malignant brain tumors or non-malignant cancers, or only for those who have a cancer diagnosis? What's the exclusion criteria? Wonderful
Right.
presentation, they say as well.
Oh, thank you very much. I have to say, I just find it the weirdest thing to talk into my computer, but but I'm hoping that it landed. Yeah, the criteria typically are diagnosis of cancer or at high genetic risk for cancer. So with some of the genetic mutations that would predispose someone to a much higher risk of cancer. Having said that, it never hurts to connect with us and ask. So as I'm thinking of a non-malignant brain tumor, those can be tumors that can expand. They can have a lot of the same symptoms and complications of a malignant brain tumor. So it never hurts to reach out and say, this is my story, this is my diagnosis. Would you be available to support me? Mhm.
Awesome. So I think we will leave it there for today. I'd like to thank Dr. Lori McFarlane so much for joining us and being so presenting such an incredible talk on the emotional impacts of cancer. And thank you to all of our viewers and attendees today. This is one of our many webinars that we facilitated in 2021 already. And with this one, as well as all of our previous webinars, are accessible on demand through our website, survivornet.ca. And the slides will also be made available through SlideShare. We have more webinars coming up. We have 2 more coming up in 2021. So stay tuned for information regarding that coming to your inbox as well. The next one is on October 7th, and we'll be turning our attention to breast cancer, and we'll have another member of the Inspire Health team on October 21st, which will be another great chat, I'm sure, as well. If you're not seeing our emails in your inbox, please check your spam or junk mail folder, as we do use a third-party email service. So check your spam and junk and mark us as safe or move us into your inbox. And yes, finally expect an email with the links for this recording and the slides that will be sent to the email you registered with. So thank you again for attending, everyone, and enjoy the rest of your day.
Thanks again, Yeshua. And thanks everyone for attending. I really appreciate your attention.
All right.